My name is Camilla Svensson. I'm an assistant professor at the Karolinska Institute in Stockholm. Pain is a big problem for patients with rheumatoid arthritis. Of course, there's been a big change over the past 10-15 years with the introduction of new anti-rheumatic drugs. These new drugs are really quite good in reducing the level of inflammation and controlling the disease. I think that we thought that with these new anti-rheumatic drugs, pain would stop being a problem because we all assumed that the pain was mediated by the inflammatory process. Recent surveys shows that this is actually not the case for a fairly large population of RA patients. Even though they are in remission, pain continues to be a problem. And this is a question that we are addressing in my lab. When I started to look into which animal models that are used to study pain in rheumatoid arthritis, I was surprised to see that there's a big disconnect between the models that we as preclinical pain researchers were using compared to what the rheumatologists were using trying to understand the disease. So we have spent time assessing and validating pain in models that are used by rheumatologists for, again, studying the pathology of the disease. And we have made the same finding, that even though we are inducing flares of inflammation, pain-like behavior in the animals do not follow the degree of joint inflammation. So even though the inflammation resolves, pain-like behavior becomes persistent. So I will talk about animal models of long-term inflammation that can be used as a tool to understand what an episode of joint inflammation does to the sensory nervous system. I think that these type of models will be very useful tools to dissect this process. I also believe that it's really important to start to study the communication between the nervous system and the adaptive immune system, B cells and T cells. We have some quite fascinating findings indicating that B cells and T cells are also important for long-term pain after an episode of joint inflammation.